Hello, my name is Jody Zellner. Thank you for the opportunity to talk with you today about the basics of Medicare. For many, Medicare is like a new language. It starts with learning the words and putting them together gradually into sentences. Then you become more fluent. United Healthcare, one of our strategic partners, has tried to simplify this process through a Medicare Made Clear program. We hope you'll walk away today with a new vocabulary and a clear understanding of what Medicare is, how it works, and most importantly, how it can work for you. These are the top 10 questions that United Healthcare hears from people around the country. We'll try to answer them for you today. First, we'll define what Medicare is and who is eligible for it. Next, we'll talk about Medicare if you plan to work past 65. Then we'll look at different options for Medicare coverage options and costs. After that, we'll touch on how to choose coverage and explain the different enrollment periods. Last, we'll talk about how you may be able to save money and where you can find more information. When we're all done, if you have more questions, we'll try to answer those too. Let's get started. There are some common misperceptions about Medicare, so let's go over a few basic facts about what Medicare is and what it is not. Medicare is health insurance for older Americans and disabled Americans and currently serves more than 62 million people in the United States. It is funded in part by federal payroll taxes paid by employers and employees. The tax is labeled FICA on pay stubs. Medicare is an individual insurance, which may be confusing if you're used to getting coverage for your spouse, you, and your children through an employer plan. Medicare is not free. You will have some costs to pay, which we'll cover in a bit. Medicare is also not a family health plan. Each person must meet Medicare eligibility individually, and each person is covered as an individual. For example, one spouse may turn 65 and enroll in Medicare while the other spouse is not eligible yet. Finally, Medicare is different from Social Security. It is also different from Medicaid, which is health insurance for people with limited income and resources. We'll talk more about that next. Let's quickly touch on Medicaid. Medicaid is a state government program that helps pay health care costs for individuals, families, and children with limited income and resources. Programs vary from state to state but do follow federal guidelines for benefits. Eligibility varies from state to state. Medicaid and Medicare can work together. In fact, some people can have both Medicaid and Medicare. These people are called dual eligible. We'll talk more about this later. So we've already said that Medicare is an individual insurance, but who can get it? As you might guess, there are eligibility requirements for Medicare. First, Medicare is for U.S. citizens and for legal residents living in the U.S. for at least the previous 5 years. You must also meet one of the following requirements. Be age 65, younger than 65 with qualifying disability and receive the disability benefits for 24 months, or any age with a diagnosis of end-stage renal disease or ALS. Each individual enrolled in Medicare gets a card with a unique number on it. Numbers are randomly generated and assigned. You can see here what a Medicare card looks like. We previously mentioned the term dual eligibility. Now we'll dive into that a little more. People who are dual eligible can have both Medicare and Medicaid. And yes, the two programs can and do work together. If you have both Medicare and Medicaid, the two will work together and may cover most of all your healthcare costs. Additionally, dual eligible individuals may be eligible for special private Medicare plans. For example, people with Medicare and Medicaid can get a special coordinated care plan called a dual special needs plan. So we've covered who can get Medicare, but before we look at what Medicare covers, let's talk about a situation many of you may be in today, and that's working past age 65. If you plan to work past age 65, your Medicare decisions may be different. In fact, you may be eligible to delay Medicare enrollment altogether. This is generally an option for people who work for an employer with 20 or more employees and have an employer health care coverage that is considered creditable by Medicare. Specifically, your plan's prescription drug coverage must be as good as or better than Medicare Part D. People who have health coverage from an employer with fewer than 20 employees must enroll at age 65 or they could face late enrollment penalties. But what if your health insurance is through your spouse? Well, in this case, you may be able to delay or you may still need to enroll at age 65, even if the spouse's employer has 20 or more eligible employees. This is because employers can have their own rules for covered dependents. Some employers require covered dependents of Medicare age 65 to enroll in Medicare. You can ask the employer benefits administrator to learn more about your options for this specific situation. There are some important things to know about getting Medicare when you continue to work. First off, Medicare and your employer insurance can work together. Medicare will typically be a secondary to your employer insurance until you leave your employer or lose their employer insurance, whichever happens first. Then Medicare will become the primary. Second, if you take any part of Medicare, you will no longer be able to contribute to a health savings account. Think carefully about this if you're eligible to delay Medicare enrollment and you're going to keep working. Medicare Part A may seem like a great idea to go ahead and get, even if you keep working, because for most people it's premium free. But if you want to keep contributing to your HSA, it may not be the right fit. Finally, Medicare will not cover your spouse or children. If you decide to take Medicare and also dropped your employer coverage, you'll want to talk with your employer's benefits administrator to understand what options they may offer for your spouse or children. For example, some employers may offer COBRA. Make sure you know what dropping your employer coverage from Medicare only means for you and your family. Let's move on to what Medicare covers. You may have heard about the different parts of Medicare, A, B, C, and D. First, we'll explain Medicare Parts A and B. Then we'll explain private Medicare and Medicare-related coverage options, Medicare Advantage Part C, Medicare Prescription Drug Coverage Part D, and Medicare Supplement Insurance or Medigap Insurance. First up is Original Medicare, the core coverage provided by the federal government. It has two parts. Part A is hospital insurance, Part B is medical insurance. Let's look at each of these things, starting with Part A. Part A, hospital insurance, covers the services provided during an inpatient hospital stay. Most covered services are listed here. This includes your room, your meals, your nursing, and other services. One important thing you may notice missing from the list is doctor services. That's because doctor services are covered by Part B, even when you're in the hospital. Another thing to point out is that if you want a TV or phone in your room, you may have to pay for it. Part A doesn't cover these items. It also doesn't cover custodial care, which is the care that helps you with your daily life activities like eating and bathing. Here are some additional important facts about Part A. Part A has a premium, but few people pay it. Remember the FICA payroll taxes? If you or your spouse paid that for 10 or more years, you get Part A premium free. You can't be denied Part A coverage regardless of your health or financial status. And you're covered at any hospital in the country that accepts Medicare. Finally, you need to know a few terms to understand Part A benefits. Part A coverage and costs are based off of benefit periods. A benefit period begins the day you are admitted to the hospital and ends after you've been out of the hospital for 60 days in a row. Observation status is another important term. Part A covers hospital stays when you are admitted as an inpatient by doctor's orders, not if you were there for an observation, even if you stay overnight. Part B would pay some of these costs. Lifetime reserve days are extra covered hospital days you can draw on if you are in the hospital longer than 90 days, the maximum length of stay for a covered benefit period. You get 60 lifetime reserve days. Each can be used only once, but they can be applied to different benefit periods. We'll come back to these terms in a bit when we talk about costs. Now let's look at Part B, medical insurance. The main covered services are listed here, including doctor's visits, the tests or exams your doctors might order, and other outpatient services. Also, as we've discussed, Part B covers doctor services when you're in the hospital as well. There are a couple things to point out here. First, the annual Medicare wellness visit is an opportunity to meet with your doctor and discuss your health status and goals, things that a regular visit may not provide for. It's covered 100% with no copay as long as it sticks to its purpose. If the discussion veers into current health problems like a cough, for example, or if you received additional services that are not part of the visit, like lab tests, procedures, or certain other services, then there may be a cost. It's good to know this ahead of time to prevent any surprises. The second thing to point out is about medical equipment, also called durable medical equipment or DME. To be covered, the equipment needs to be medically necessary and prescribed by a doctor. It also needs to come from a supplier approved by Medicare. So, in most cases, you just can't buy a walker somewhere and have Medicare pay for it. Talk to your doctor first. Here are some additional important facts about Part B. Part B has a monthly premium. If you're receiving Social Security or Railroad Retirement Board benefits, the amount will be deducted from your check each month. Again, we'll talk more about costs in a minute. Just as with Part A, you can't be denied Part B coverage regardless of your health or financial status, and you may see any provider in the country that accepts Medicare. Finally, Part B charges a premium penalty for late enrollment unless you qualify for a special enrollment period. We'll cover enrollment later in this presentation, but some people, including those who work past age 65, may delay Part B enrollment without penalty. So we've gone over what original Medicare, Part A and B, covers. Now let's look at what it doesn't cover. Many people are surprised to learn that they will have out-of-pocket expenses, which could be significant depending on individual healthcare needs. Further, there is no out-of-pocket maximum, no financial protection with original Medicare. A serious illness or injury could create a real financial stress. Another possible surprise is that original Medicare does not cover prescription drugs, which can be a big expense as we get older. Other non-covered services include routine dental, vision, or hearing, long-term care, such as in a nursing home, custodial care, which includes bathing, eating, and dressing, and may be called activities of daily living, care received outside the U.S. except in limited circumstances. The good news is that there are some options that may help you with these non-covered items. Let's explore those now. Even from these simple examples, you can see that original Medicare doesn't cover everything, and that out-of-pocket costs for healthcare items and services could add up and take a big bite out of your budget. The good news is that you have options for other coverage that can cover other key things, like prescription drugs, and that may help turn that budget bite into a nibble. On that note, we are ready to talk about what Medicare Part C, Part D, and Medicare supplement insurance plans cover and how they may work when you're deciding on what Medicare coverage to choose. Now we're going to see how Part C, or Medicare Advantage, Part D, and Medicare supplement insurance, or Medigap plans fit into the picture. You have two options for more coverage. Option one is to add Medicare supplement insurance and or Part D prescription drug plan insurance to original Medicare. The Medicare supplement insurance will help pay some of the out-of-pocket costs not paid by Medicare Part A and Part B. Part D will then cover the prescription drugs. Option two is to choose a Medicare Advantage plan, Part C. Most Medicare Advantage plans include drug coverage and additional benefits such as routine dental and vision coverage. Before we delve into these two options, I want to point out that all three of the components shown, Medicare supplement insurance, Medicare Advantage plans, and Part D plans, are offered by private insurance companies. What this means in part is that there may be a number of plans to choose from, and they may vary in coverage and costs. By contrast, original Medicare is administered by the federal government, and benefits and costs are the same for everyone. Medicare Advantage and Part D plans are approved by Medicare and held to the standards set by Medicare. These private plan options are provided to give you more choices and the ability to fill in for what isn't covered by original Medicare. We'll circle back to this graphic later. For now, let's continue through the alphabet and we'll talk more about Medicare Advantage, otherwise known as Part C plans. Part C is Medicare Advantage. It's an alternative to original Medicare and offers another way for you to get your Medicare Part A and Part B benefits plus more. You still have Medicare, and Medicare contracts with the plan to administer your Part A and B benefits. You'll also continue to pay your Part B premiums directly to Medicare. Plans are offered regionally, often in a county or state, by private insurance companies. Most plans often include other benefits like prescription drugs, dental, and vision. All your benefits are covered under one plan. By law, Medicare Advantage plans must provide all the benefits that original Medicare does. So plans combine Part A and Part B coverage in one package. One exception is hospice care, which is covered by Part A even if you have a Medicare Advantage plan. Most Medicare Advantage plans also include built-in prescription drug coverage, or Part D, which we'll talk about next. Finally, Medicare Advantage plans may also offer additional benefits, including coverage for dental, vision, hearing, and fitness programs. The result is an all-in-one plan similar to what you may be used to having through an employer. There are different types of Medicare Advantage plans. Most are coordinated care plans, where care is delivered through a provider network. You may get care outside the network, but you may pay more or even the full cost. Most coordinated care plans are HMO or PPO plans. HMOs have a network of doctors, hospitals, and other care providers you use to receive covered services. POS plans are a type of HMO plan that also lets you see providers outside the plan network for certain covered services. PPO plans have a provider network you can use, but also offer more freedom to see providers outside the plan network for all covered services. Special needs plans are designed specifically for people with certain healthcare needs. The dual special needs plans we talked about earlier is a kind of special needs plan specifically for those with both Medicare and Medicaid. There are also chronic special needs plans for people who have certain chronic conditions such as diabetes, institutional special needs plans for people living in a skilled nursing facility, or institutional equivalent special needs plans for people living in an assisted living facility and they need the same kind of care as those living in a skilled nursing facility. Private fee-for-service plans typically offer more flexibility in choosing providers than you can in other types of plans. In general, you can get care from any Medicare-approved provider who accepts the plan's terms and conditions. Medicare savings account plans combine a high-deductible health plan with a Medicare savings account. They generally offer more choice with more financial risk. Here are some additional things you need to know about Medicare Advantage or Part C plans. You must be enrolled in Part A and Part B to be eligible for a Medicare Advantage plan. You must also live in the plan's service area and you can't be denied coverage. You may pay a premium to your Medicare Advantage plan and continue to pay your monthly Part B premium to Medicare. It's easy to get confused by this. The plan provides Part A and B coverage, but you still need to enroll in Parts A and B. As we mentioned, you're still in the Medicare program. Medicare contracts with the plan to administer your benefits. Importantly, unlike original Medicare, every Medicare Advantage plan has an annual out-of-pocket maximum for Part A and Part B services covered by the plan. Once you've paid this amount, the plan covers the entire cost for these services for the rest of the year. Keep in mind the out-of-pocket maximum doesn't apply to your monthly premium, prescription drug costs, or any cost for additional benefits not covered by original Medicare, like routine eyewear or hearing aids. Medicare sets the standard maximum, but many plans cap your costs below this amount. The out-of-pocket maximum limit for 2024 is $88.50. Now let's move on to Part D, prescription drug coverage. An easy way to think about this is D is for drugs. Remember, drugs are not covered by original Medicare except in select circumstances. You can get drug coverage in two ways. One, through a separate standalone Part D prescription drug plan, or two, through a Medicare Advantage plan, as we just discussed, with a prescription drug plan included. Standalone Part D plans can work with original Medicare, Medicare supplement insurance plans, and select Medicare Advantage plans, including private fee-for-service plans and medical savings account plans without drug coverage. And like Medicare Advantage plans, Part D plans are offered by private insurance companies. Each Part D plan or Medicare Advantage plan that includes prescription drug coverage creates a list of specific drugs that it will cover. The list is called the formulary. Each plan has its own list of covered drugs, but every plan must cover a range of both generic and brand name drugs that are generally needed by people on Medicare. Plans also cover all commercially available vaccines, like the single shot, that are not covered by Part B. Part B covers things like flu and pneumonia shots. Most Part D plans group the drugs they cover into levels or tiers. Drugs in different tiers have different costs. For example, you may pay more, a higher copay or co-insurance, for a Tier 5 drug than a Tier 2 drug. Also, plans may have a deductible for some tiers and not for others. When choosing a plan, is it important to make sure the drugs you take are on the plan's list of covered drugs and to understand the costs, which can vary from plan to plan. Let's take a minute here to talk about the different Part D cost stages, especially the Part D coverage gap, commonly known as the donut hole, since it may be confusing to some people. There are 4 Part D coverage stages. The stage you're in determines the amount you pay when you fill a prescription. Each stage has a dollar limit set by Medicare that marks when you exit the stage and enter the next. The limits, shown here, can change from year to year. You may begin in the deductible stage, if your plan has one, where you would pay the full cost for your drugs, and then enter the initial coverage stage, where you usually pay a copay. If your drug costs reach the limit for the initial coverage stage, then you would enter the coverage gap, where you would pay a greater share of the cost of your drugs, 25% for generic and 25% for brand names in 2024. Not everyone enters the coverage gap. If you do and your drug costs reach the limit, then you enter the catastrophic coverage stage and you pay reduced copays for the rest of the year. The cycle starts over again on January 1st. This is going to change in 2025. A few final points about Part D. You are eligible to join a Part D plan once you're enrolled in Part A, Part B, or both. Plans often have pharmacy networks that you need to use to get the plan's pricing. Plans may vary quite a bit in terms of what specific drugs they cover and what your costs may be. A final key point is that you could be charged a premium penalty if you are late enrolling in Part D unless you qualify for a special enrollment period. I'll say more about this in a few minutes. Now we're going to come to Medicare supplement insurance, or what is often called Medigap plans. Medicare supplement insurance plans, which are also offered by private insurance companies, are different from the plans we've discussed so far. As the name says, they supplement Medicare, so they are not Medicare plans in and of themselves. Medicare supplement insurance plans help to pay some of the out-of-pocket costs that come with Medicare, like deductibles and coinsurance. They can only be used with original Medicare and not Medicare Advantage plans. Plans are standardized by the federal government. There are 10 plans labeled with letters. Plan A, for example. Every plan of the same letter provides the same benefits no matter what insurance company offers it. Massachusetts, Minnesota, and Wisconsin are exceptions to the rules as these states standardize their plans differently. It is also important to note that Plan C and Plan F are only available to individuals who are eligible for Part A or turn 65 before January 1st of 2020. Here are some of the costs that Medicare supplement plans may help you with, and some they may not. You'll see that they help pay for coverage already provided by original Medicare and may extend it in some cases, as with extra hospital days. Medigap plans can help with Part A deductibles, original Medicare copays, coinsurance, and providers' excess charges, cost of blood transfusions, and the cost of foreign travel emergency. Additionally, some plans may cover Part B deductible costs, but only for those who are eligible for Part A or turn 65 before January 1st, 2020. But, except for foreign travel emergency coverage, Medigap plans don't fill in for what original Medicare doesn't cover, such as prescription drugs, dental, and vision care. Some plan providers may offer value-added services for free or on a discounted basis, but they're not part of the Medigap plan directly. This table may help you visualize which costs different standardized plans help with and the level of coverage. 100% means 100% covered. The main point here is that Medigap plans vary. Now for some facts about Medicare supplement plans. You must be enrolled in Part A and Part B to be eligible for a Medicare supplement insurance plan, and you must choose from the plans offered in your state. Also, there is a set enrollment period when you can't be denied coverage or charged more based on your health history. We'll talk about more about this in a minute when we cover enrollment. Medicare supplement insurance coverage is nationwide and goes with you wherever original Medicare does. And while plan benefits are standardized, each plan sets its own premium. The amount can vary even for the same coverage. So you and a friend who lives in a different state may both have a Plan F, but your premiums may be very different. In general, though, among the different standardized plans, the broader the coverage, the higher the premium. So, for example, Plan A, which we said provides selective help, may have a lower premium than Plan F, which covers more of your costs. Finally, you must continue to pay your Part B premium to original Medicare. Now let's talk about other costs associated with Medicare. Now we'll talk about some other definitions. Most people are familiar with the terms premiums, deductibles, and copays, which are all defined here. Coinsurance may be a less familiar term. It's an amount you pay when the cost of a covered services is split with you. It's determined by a percentage. For example, the cost of a service is covered 80% by the healthcare company and you pay the remaining 20%. You may have some or all of these types of costs with Medicare, again, depending on your coverage. Finally, if you choose a Medicare Advantage, Part D, or Medicare Supplement insurance plan, these are costs you may pay for each. Costs will vary by plan and by provider. Let's start with Medicare Advantage or Part C plans. With Medicare Advantage, some plans have low to $0 premiums. Some plans have high deductibles and others do not. You want to take a look at the plan carefully to see if they either have premiums or deductibles and how much they are. Medicare Advantage plans may also charge copay or co-insurances amounts for the covered healthcare services. Medicare Advantage plans also have an out-of-pocket maximum, which helps protect you financially by limiting your out-of-pocket costs. Finally, with Medicare Advantage plans, you will still have to pay the Part B premium to Medicare. With Part D prescription drug plans, you may have a monthly premium, deductible, copay, and co-insurance amounts. Part D plan costs will vary by plan and provider. Costs may also vary for your deductibles and copays if a plan has a tiered formulary. In this situation, drugs may have different and/or higher deductibles and/or higher tiers, and copays may be specific to certain drugs or tiers as well. Finally, Medicare Supplement insurance plans, or Medigap plans, may charge a monthly premium and also have a deductible and copay amounts. There are different types of Medigap plans, and private insurers set their own premiums, so you'll need to review the specific plan carefully to find out what your costs could be. Some Medigap plans may also cover protection for out-of-pocket costs, but again, each plan and provider is different, so be sure to look closely before purchasing. We've covered a lot. Hopefully you now have a basic understanding of the different parts of Medicare, Medicare Supplement insurance, and the cost you could pay. Now what? Now we show you how to put the different coverage options together to meet your needs, like this. There are 7 combinations here. Right away you can see choices with A and B, combos 1 through 4, or C, combos 5 through 7. But not with A, B, and C together. Remember, Medicare Advantage Part C is an alternative to original Medicare Parts A and B, and Medicare Supplement insurance only works with the original Medicare Parts A and B, not with Medicare Advantage. Part D gets along with everyone, but note option 7 is only available for certain Medicare Advantage plans. Now that we've reviewed the coverage options, let's go back to the graphics we looked at earlier, only as a whole picture. Step 1 is to enroll in the original Medicare program. Again, original Medicare consists of Part A and B and is provided by the federal government. Step 2 is where it gets interesting. Here you decide if you want more coverage than original Medicare provides. If you do, like we saw in the previous slide, you have 2 options. Option 1, add plans to original Medicare, or option 2, choose a Medicare Advantage plan instead. You can get Part D coverage with either option, so the choice when looking at additional coverage is really between Medicare Supplement insurance and Medicare Advantage plans. Let's look at this more closely. Let's think about this choice in terms of coverage, cost, and convenience. Coverage. Provider choice is one of the main considerations between these coverage options. Medicare Supplement Plan insurance helps pay for care from providers nationwide as long as they accept Medicare. Medicare Advantage plans generally have a provider network and each serves a set geographic area. Another consideration is what you need coverage for. Do you want coverage for prescription drugs? Do you want dental or vision? Questions to ask. Am I able to get the most of my health care needs met near home? Am I willing to change doctors if mine isn't in a planned network? Do I want coverage for additional healthcare services like dental, vision, hearing, or fitness? Costs. Both options help you manage costs, but in very different ways. With a Medigap plan, you may pay higher premiums than those of a Medicare Advantage plan, but other costs may be lower. With a Medicare Advantage plan, you pay co-pays, but the premium may be low, and you're protected by an out-of-pocket maximum. Questions to ask yourself. How often do I use healthcare services? Would I rather pay higher premiums even when I don't use the services, or would I rather pay co-pays when I do use the services? What level of Medicare supplement insurance can I afford? Finally, convenience. Many people who opt for a Medigap plan also buy a Part D plan with Original Medicare. That's 3 different plans. With a Medicare Advantage plan, it's usually just one. Questions to ask. Which coverage option is the best fit for my lifestyle? How do I feel about working with multiple insurance carriers? What Part D plans are offered where I live, and what Medicare Advantage plans are offered where I live? Whether you choose a Medicare supplement insurance or Medicare Advantage, be sure to consider your needs and budget and to compare plans before making a decision. Once you've decided on your coverage, you're ready to enroll. So let's explore the different enrollment periods. Many people first enroll in Medicare during their initial enrollment period, or IEP. Your IEP is 7 months long. This includes the month you turn 65, plus the 3 months before you turn 65, and the 3 months after you turn 65. If your birthday is on the first of the month, then your enrollment period begins and ends 1 month earlier. So you would have 4 months prior, 3 months after. If you qualify for Medicare due to disability, then your IEP includes your 25th month of receiving benefits, the 3 months before and the 3 months after. You are enrolled in Medicare Parts A and B, and automatically, if you're receiving Social Security or Railroad Retirement benefits at age 65, you'll get your Medicare card in the mail. Otherwise, you need to sign up online yourself, on the phone, or at your local Social Security office. During the initial enrollment period, you can also enroll in additional coverage, Medicare Advantage, Medicare Prescription Drug Plan, or Medicare Supplement Insurance. To get any of these 3 plans, you will need to enroll directly with the private insurance company offering the plans. A final note. You may refuse or delay Part B enrollment and just take the premium-free Part A. This may be a good idea for people who have employer coverage or other creditable coverage. Some employers require you to take the full benefits Part A and B at age 65. You may also join a Medicare Advantage or Part D plan during your IEP if you're eligible. Ensure if you decide to delay that you are doing so won't mean paying a late enrollment penalty later on. It is important to pay attention to the timing of your enrollment to avoid late penalties. We'll talk more about these penalties in a minute. If you miss your IEP, don't panic. You'll have another chance to enroll called the General Enrollment Period, or GEP. The GEP is January 1st to March 31st every year. You can enroll in Parts A, B, or both. If you're eligible, you can join a Medicare Advantage plan or Part D plan until June 30th of the same year. Late enrollment penalties may apply depending on your timing. Again, we'll talk about that in a minute. Remember, you must be enrolled in Part A and B to be eligible for a Medicare supplement insurance plan. You are not subject to medical underwriting for 6 months after you enroll in Part B at age 65 or older. You can still apply for medical supplement insurance plan after this time period, but you may be denied coverage or charged more based on your health history. Some states may allow for additional open enrollment periods. We talked about working past 65 a bit earlier and how you may be eligible to delay enrolling in Medicare. If you qualify, Medicare provides a special enrollment period for people who work past age 65 and then lose their employer health coverage. You have 8 months to enroll in Part B and Part A if you haven't already. You may enroll in Medicare Advantage or Prescription Drug Plan, Part D plan, within the first 2 months of your employer coverage ending. It's important to pay attention to this timing. As we've mentioned, both Part B and Part D charge late enrollment penalties. The Part D enrollment deadline is especially important since it happens quickly and can sneak up on you. One more thing, make sure your employer provides you with proof of creditable coverage. This means that it's at least as good as the Part D coverage provides. If your drug coverage doesn't meet this standard, you could be penalized for not enrolling in a Part D prescription drug plan, even if you have prescription drug plan through your employer because it's not credible. Remember that your 6-month Medicare supplement open enrollment will be triggered once you're enrolled in Part B. Also, you must be enrolled in Parts A and B before you can enroll in a Medicare supplement or Medicare Advantage plan. So we've mentioned penalties a number of times. Let's take a closer look at them. Parts A, Parts B, and Part D may charge late enrollment penalties. The Part A penalty doesn't apply to many people since most of us get a Part A premium for free. But for those who have to pay, the penalty is an additional 10% of the premium amount. You pay the penalty for twice the number of years you could have had Part A but didn't sign up. The penalties for Part B and Part D could apply to more people. It is important to understand these enrollment periods we discussed earlier and to enroll on time in order to avoid them. The Part B penalty is an additional 10% of the premium for each full 12-month period you could have had Part B but didn't unless you qualify for a special enrollment period. You'll pay the penalty for as long as you have Part B. Your Part D penalty is an additional 1% of the current average plan premium for each month you're late. You pay the penalty for as long as you have Part D. Remember again, you need to have creditable coverage as good as Part D to avoid this penalty if you enroll after your initial enrollment period. So hopefully you enroll on time and with no late penalties. That's it, right? Well, unfortunately, not exactly. Medicare is not a one and done decision. Things may change in your life, your health, your finances, or even in your Medicare plan. So it's important to review your coverage every year to see if it will work well for you going forward. You can change your coverage choices if you decide during the medical annual enrollment period, which is October 15th through December 7th every year. The new coverage goes into effect January 1st of the following year. The kinds of changes you can make are listed here. We won't go into this too deeply. The main message is that Medicare provides this annual enrollment opportunity so you can keep your coverage up to date with your lifestyle needs. There is also another enrollment period. The Medicare Advantage open enrollment period is specifically for people with Medicare Advantage plans and runs from January 1st to March 31st of each year. You must be a member of a Medicare Advantage plan on January 1st to be eligible for this enrollment period. During this time, you may switch to a different Medicare Advantage plan or drop a plan and go back to original Medicare, Parts A and B. If you return to original Medicare, you may also enroll in a Part D plan until March 31st. You may enroll in a Medicare supplement plan as well. You may only make one coverage change during this enrollment period. The next opportunity is the fall annual enrollment period unless you specifically qualify for a special enrollment period. Medicare offers a special enrollment period, or SEP, for qualifying life events. This is for those times when life doesn't happen on Medicare's convenient schedule. Certain situations, such as moving to a new home or certain changes in your healthcare coverage or health, can qualify you for a special enrollment period. In most cases, you have 2 months from the date of the qualifying event to make coverage changes. During a special enrollment period, you may join, switch, or drop a Medicare Advantage, Part C, or prescription drug plan, Part D. However, there may be some restrictions depending on how you qualify for the SEP. Again, we won't go into this much more. The main point is that Medicare provides for times when you might have to change your coverage outside the usual annual enrollment period. We've talked about your Medicare coverage options, the costs you may have, and enrolling. Now let's talk a little bit more about ways to help save money. One way to help you save money is to do your best to live a healthy lifestyle and take care of your health. Medicare covers a range of preventative services, many at no additional cost to you. Learn what they are and take advantage of them. You may also be able to save money by choosing your provider from within your plan's network, if you have one. If not, make sure that your provider accepts Medicare assignment and that won't charge you beyond what the Medicare will allow. And then there are drug costs, which are a concern for many people. Ask your doctor or pharmacist about ways to save. You may be able to switch to a generic or other low-tier drug and may get a better price by using a different pharmacy. And always, if you are in the hospital, ask whether you're inpatient or there for observation. It makes a difference how your care is covered and may have an impact on your costs. If you need it and you qualify, you may be able to help paying some healthcare costs. There are several programs as shown here. It's worth asking about them, even if you think you won't qualify. A good place to start is with your state health insurance program, SHIP office. You can find the number at shiphelp.org or by calling Medicare at the number shown below. I'll try to answer any questions you have at the end of the presentation today, but you may have more questions as time goes on. So here are some more places to go for additional information about Medicare. First off, you can use the resources at United Healthcare. United Healthcare is very passionate about helping people they need make informed decisions about Medicare. Medicare Made Clear is a United Healthcare educational program dedicated to providing information and resources to help you get the answers to your Medicare questions. You can also find us online and get regular updates by signing up for our newsletter and following us on social media. You can also find helpful information at medicare.gov, the official government website for Medicare, or you can call the Medicare at the number listed here, 1-800-MEDICARE. You may want to talk to your state health insurance assistance program to see if you qualify for any financial assistance, or contact Social Security or your state Medicaid office to learn about other assistance programs. Thank you so much for your attention, and I know we covered a lot today. I'll answer any questions, or if you still have additional questions, you can go to my website, www.shfinancialadvisors.com, and ask the questions there, or feel free to email me at jody.zellner, that's jody.zellner @lpl.com. Thank you for attending.